All right, so in trying to evaluate patients that maybe they have two legs that are not equal, all right, so there are signs we look out for. All right, there are also tests we do. We spoke about Barlow and Ortolani. Okay, so as you're doing those tests, okay, one of the signs you are looking out for is what's known as a Galeazzi sign. So what is a Galeazzi sign? You know, so a Galeazzi sign, or known as a Galeazzi test, is a clinical method. You want to dictate, you know, issues that have to do with, you know, somebody's what head of the femur is pulling out from the socket. That's what hip dislocation, you know, or maybe the person's leg, the length is not just, you know, accurate, you know. So how is it done? The child lies supine on their back, okay, the hips are flexed to 45 and the knees to 90, okay, with feet flat on what the examination table. Do you understand? So the examiner compares the height of the knees. So you leave every other thing. You are just trying to compare this knee and this knee. Are they at the same height? You know. So interpretation, a positive one shows that one knee will usually be longer than the other one, you know. So it may indicate that there's a hip dislocation, may indicate that what the femoral shortening, you know. It could indicate that there's what leg length inequality. You understand? So bilateral hip dislocation may not show a positive sign, making it tricky, right? So clinical use mainly for pediatric orthopedics, you know, can also be adapted for adults to access leg length differences. You understand? So it was named after what Riccardo Galeazzi, who is an Italian orthopedic surgeon who developed the test after reviewing over 12,000 congenital hip dislocation. All right, so that was it for the Galeazzi sign or the Galeazzi test.